The healthcare system in the Gambia is in a state of crisis. The scenes inside the main hospital in the country, the Edward Francis Small Teaching Hospital, resemble images from the medieval era, with patients strewn on little more than filthy mattresses in unsanitary conditions. Hospitals are meant to be places where people go to get better. In the Gambia, people go there to die, often from entirely treatable conditions. The healthcare system in the country is failing the very people who pay their taxes and who depend on the system in their hour of vulnerability and need. It's perhaps these shocking scenes that may have prompted the President to replace his Minister of Health, whose department must answer for the failure to keep Gambians healthy and alive. I've been speaking to the Swedish-based Gambian journalist and social activist Mama Linger Sar, whose investigations exposed the shocking crisis of Gambia's healthcare system. What prompted her investigations?
Really, it was pictures that I saw of the President going to visit the Faraba protest victims at the hospital, seeing the plastic bags filled with sand that were used to somehow hold broken bones together. And of course, with the health ministry getting the second biggest budget allocation in the country. So I asked around and I was told that despite the budget allocation, despite the change of government and the fact that ministers now have the autonomy to do the work that they want to do, there's still nothing has changed and people have reached out and it hasn't changed the status quo in the hospital.
So what did your investigation uncover?
You would be surprised that at the Edward Francis Small Teaching Hospital, even gloves are rationed. Nurses are given 3 sets of gloves a day, and that's what they use. So you have to reuse those gloves to kind of even try and protect yourself. But that means that you're not getting any protection. The patient that's coming to you is not getting any protection. And this has been happening for a while. There's no oxygen in the hospital. Imagine a teaching hospital like the Edward Francis Small Teaching Hospital. People are dying because there's no oxygen. There's no diagnostics lab whatsoever. They don't have the reagents that are needed to culture these samples, etc. So doctors are just treating blindly because they don't have the microbiology support that they need to be able to say that this patient has this or that. So you can go into the hospital with sepsis or with pneumonia and you're blindly treated for malaria. And guess what? You're going to die. All these are preventable deaths. Children are being born and then they pick up these viruses at the hospital there because there's so much contamination at the hospital. They don't clean the beds properly or the place properly when one woman gives birth and the other comes in, etc. So all of these things, and there's a particular bug that's going around that a PhD student actually identified that's killing babies at the hospital. This is something that was reported to the health ministry and still nothing was done about it. There's no drugs in the hospital, not even paracetamol. So I looked at it, and then this is a department where there's 16 health directors in that country. That is more per capita than any African country, than most African countries anyway. 16 directors. They have budgets, they're organizing these seminars when there is not even oxygen tanks at the hospital. There's no x-ray machine. It's not working anymore. The CT scan that's there, sometimes functional, sometimes not functional. They cannot even store blood properly because they put it in these fridges. Electricity goes off and the blood is of course contaminated, etc. And they use that and then infuse it on a patient, killing people unnecessarily. And you have health directors who are every week, they have technical assistance reports from the WHO and all these organizations lying on their desks. They will not implement one single recommendation from those reports. Yet they will still organize other workshops to be paid honorarium or whatever you call it. And imagine workshops like that in Gambia that they organize cost at the minimum $3.6 million to sit down and talk about problems that you know about. And these same ministers, when their cars break down, they order new cars or they go and get it fixed. When an x-ray machine breaks down, there's no x-ray machine at the Edward Francis Small Teaching Hospital, neither in any other health center, and it doesn't bother them.
Did the Minister of Health have anything to say about this?
When I made some of these claims, they actually issued a press release. They could not deny the fact that there's no medicines at the hospital. So what they denied was that they were not offered any help from WHO to buy medicine on their behalf and bring it into the country. When they had the money, so the most interesting thing that these guys did is they had another workshop for $3.6 million to talk about the quality of medicines that they should purchase. They organized the workshop, and of course, you know, these workshops, they get paid money, they go on these retreats, etc. So they had a retreat. to talk about the quality of drugs that they're supposed to buy. And 6 months after that retreat, still no medication has been bought, still nothing has been done, and still nobody is even following up on the action points that were agreed in terms of the quantity of medicines that they needed to order for the country. For me, I said it borders on criminal negligence. People cannot be dying needlessly and with causes that are so avoidable, and you're sitting there telling me that the person responsible did not act. You, as the health minister, did not act. Nobody in that ministry is basically acting.
And in addition to that, you received threats from people wanting you not to come out in the open and expose the problems in the health sector. Why do you think that was?
Because they felt that I was going after them and that would lead to them losing their jobs. For them, it was more about their travel privileges, their per diem privileges, their workshop privileges and stuff like that, and not the fact that they were not being accountable or responsible for serving the public. So I got threats, people telling me, you have to be careful with Gambia, with all this. I don't even know if I should mention it because I think it's so outdated. But I told them, if these people are not ashamed of themselves, I will not be afraid to expose what is happening at that ministry, because we cannot continue to watch our people dying from preventable diseases and continue to just ignore what is happening.
But what exactly were they saying would happen to you if you kept going on your investigative journey?
They actually said there were plans to take me to these marabouts, and there were plans that they would have some voodoo or whatever done on me that will make me not be able to again speak about them, because they would do some bad things to me. But
Really?
yeah, I mean, it was.
Wow.
I mean, I'm laughing about it because maybe having lived in the West for a long time, you really do not take these things as something that is even possible.
And the threats were coming from people, what, at the very top of government?
Yeah, people that were very, very top at the government, who were very close to the people that I was exposing, and really saying, you have to be careful and you have to stop.
So, are you going to stop?
No, I'm not.
The journalist and social activist Mama Lingersar speaking to me on the line from Sweden.